In TTI-621 is actually a fusion protein that blocks the CD47 binding site on SIRPα, which is a protein that is actually expressed on macrophages that are surrounding the tumor cells. And they are quite abundant macrophages. And so by we know that CD47 is more higher upregulated in cancerous cells and so in the malignant T cells, but also in other malignancies. It's not unique to CTCL. And we didn't know really when we started, but it was actually worth to give a shot. And by blocking the interaction, which allows actually the macrophages to phagocytose those cancerous cells. And I'm presenting data on intralesional application. What we see, and it's quite striking, and we really didn't expect that, following even a single injection, we see a tremendous response within days. Actually, when patients come 2 days later, we already see that the lesions have improved. And I have seen a patient who had only local regional lesions, and by a single injection he achieved actually complete response, which is quite encouraging. Not every patient is achieving a complete response. It's also in part because you're injecting just a few lesions, and currently we're injecting 3 lesions, and we're moving to next lesion once they're completely cleared. So I think it's very, very encouraging. The downside is you have to inject to get really an effect. Maybe subcutaneous application, maybe the future, or intravenous.